Hi, this is Dr. Josh Wagner, and I'm fortunate to be with Dr. Adam Osenga in Indiana, who's been using the perfect patient funnel strategies for about a year now, and has seen some not only great growth in practice, but overall growth in just life and mindset and a lot less stress. And this is what I want more chiropractors to have and to hear it from him, someone who's experienced it, exactly what was it like before and after. So Adam, thanks for agreeing to get on the call. And could you just start off by sharing what some of those feelings, mindset, stresses were in practice before using these strategies?
Sure. Thanks for having me, Josh. To start off with, I was very stressed just starting my practice, snapping basically, very overwhelmed, like relationships were struggling. And I just felt like I did not have enough time in the day to get things done and to be present, I guess, with my family. So since joining the perfect.
And was it? Let me just butt in. Sorry, was it
Sure.
Was it more family relationships that were struggling because of the practice stress?
Yeah, certainly. I was not. I just did not feel like I was present at home. I felt like I was basically living with inside the practice, and that the practice was basically controlling me.
Mm.
And so with that, I would say I was not the dad or the husband that I needed to be most of the time. So since joining, I noticed right away, even within like the first month or two, that I was more centered. I had more, I guess, financial peace, just knowing that treating people well, listening to them, figuring out what their wants and then their needs were as far as a treatment, and then using that basically at home as well with the wants and needs of my family. So joining the perfect patient funnel has helped me not only in a practice sense, but also just as a person. I believe that less stress now, more financial independence as well. I don't feel like I live at my practice. I actually can be out of there and not feel like I'm sleeping there for the most part. So it has been absolutely fantastic in a little bit over the year. Of course, the good things, my practice has grown exponentially using a lot of the techniques, but I believe that it probably has grown because I got myself right to be a better person, be a better manager, be a better boss, a better leader, and then just overall a better listener, I guess, to my patients.
Absolutely. And something I'm really impressed with you, Adam, is even with all of that growth, we were just talking before the recording started, and you named 3 books that I've recommended. That 2 of them you've already started. The third one is after those, that are all for growth and benefit in different areas of your life, from business structure to financial and affluence mindset to just more personal organization. And that impresses me of you, that you're always in the mode of learning and growing, even though things are going really well for you. So I just want to give you a lot of credit for that. Thank you.
And that's definitely been through your help. I guess you kind of get stuck in ruts. So you have some great advice, just pointers basically to kind of get us, like if we're going in the wrong direction, to point around, to get turned around and go into the right direction. So these books have been fantastic, and it's great to have somebody give that nudge if you're stuck in the rut and to essentially get you out of it.
Excellent. Anything else you think is worthwhile to share, or you had a mind to share with any DCs out there that may have felt or may be feeling how you were early on in practice?
Yeah, certainly. So I guess now I have that freedom, which is so important in terms of more of a financial freedom, and then probably the biggest thing is just freedom to be present with my family when I'm not at the office. So I'm not constantly thinking about, oh man, where's my next new patient going to come from? Cruise control is a bad word, but it's almost like things just click and they just happen and they just flow.
And you said a good point. How cruise control is a bad word, and in some ways you're right. Like if you just feel like you're coasting, that's bad. But how you're doing it, you have things on cruise control, and you're choosing to still grow, referencing what we just talked about with the books, rather than being lazy. So that's where it's a good thing. Your thing's on cruise control, and you're still growing, rather than taking advantage of and being lazy, which will be an inevitable roller coaster ride of ups and downs, and that's not you.
Yeah, thank you very much.
Yeah. Hey, thank you for sharing, the ups and the downs that you've experienced, which we've all had, but not everyone wants to admit them. And thank you for giving the service and the listening and the attention to those patients that come to you and all the future ones, because that's what makes the difference, and that really is what makes practice so much easier for you, so you can have that better life outside of practice. So thank you for all you do, Adam.
Thank you.
All right. I'll talk to you soon.
Okay.